Hi, my name is Dr. Jordan Carcaville. I'm a Mohs surgeon and cosmetic dermatologist. Today's topic is what is the most common question about lipomas on Google? So let's get into it. The first question is, how do I know if it's a lipoma versus a cyst? Sometimes it's really hard for us to even know if it's a lipoma or a cyst. Sometimes my assistants and I even, take guesses. Lipomas generally feel a little bit squishier, but you can definitely have a squishy cyst also. So sometimes it's not until we take that first incision that we are all surprised whether it's going to be cyst contents, bombing out, or if it's just that yellow fat, which is what a lipoma is. So we're often surprised ourselves. It's hard to know. The next question is, are lipomas cancerous? Lipomas as a whole are generally benign. So lipoma in itself, that term means a benign growth of fat. There is an entity called a liposarcoma, which would be a malignancy of the fat. These are very, very rare. I've only seen 1 or 2 cases in my entire career. That being said, we always send a sample of our lipoma that we take out to the laboratory to get a pathology report so that we know that you're safe. The next question is, can I pop my lipoma? That's a great question. No, you actually cannot pop a lipoma. It's not in a sac that it might be encapsulated, but it's not in a sac in the same sense as a cyst. So you can pop a pimple or a cyst, but you can't really pop a lipoma. The next question is, should I get my lipoma removed? Lipomas often grow over time, so while it's typically not an urgent matter, people generally like to get them out, especially if they're getting larger and you can see them underneath your clothes, especially if it's a lipoma on your forehead, that just can become more and more obvious. Lipomas can occur anywhere, and so usually people will come and see us if it's starting to become more noticeable or bothersome. If your lipoma or your lump on your skin is tender or it's growing rapidly, definitely come get checked because those are indications that something more may be going on. If you want to learn more about skin health, please feel free to subscribe or drop any questions you have in the comments below. Thanks.